I work with the State Health Access Data Assistance Center, and our role is really to help states use data to inform policy. And in this world of health reform, this is hugely important. We draw on survey data a lot for any of our estimates of who has coverage, who doesn't have coverage, who has access, who doesn't have access. And this phenomenon of having more and more people living in cell phone only or wireless households really creates a problem because they're typically not brought into telephone surveys. In this current economy, more and more people are actually dropping their landline service, which is problematic for survey researchers like me. So we really have to think about how to capture that population in some way, shape, or form. Otherwise, any of our estimates are going to be biased. So what we know from the National Health Interview Survey is that people that are in cell phone only households are really different. They differ in age, ethnicity, home ownership, so they tend to be more mobile. They're young, healthy adults typically that have worse access to services and have more difficulty getting health insurance. The chart really shows a lot of variation from state to state. Minnesota is up there at around kind of 25%, but the range is pretty dramatic. It's not what you would expect. If you look at the chart, we kind of thought California would be really high. So when we look at kind of the ethnic composition of wireless-only households, they tend to be higher among Hispanics and African Americans. Yet California is actually on the lower end of that. Can we really monitor rates of health insurance coverage and how that's shifting between private and public sectors? How many people are actually gaining insurance, and what form of insurance are they gaining at the same time as kind of we worry about being able to actually capture a representative sample of the population in our surveys. And so we really have to be in tune to these wireless-only households, households that have no service, households that have both, and how do we really account for them so that we know whether or not health reform is working, and who is it working for.